Hello, my name is Charles Jasper. I'm in Dr. Seelig's class at Moore State University, 651, and today I'm going to talk to you about lower back pain. I myself have experienced lower back pain from playing sports, lifting weights now, exercising regularly. Sometimes I have acute symptoms of lower back pain, and they can really be debilitating at times and very, very uncomfortable. Um, I'm sure a few of you watching this have had lower back pain because lower back pain is one of the most widely experienced health problems in the world. Believe it or not, around 60 to 80% of the industrialized world, their citizens have experienced lower back pain um, during their lifetime. And lower back pain can be defined as a discomfort or pain localized between the costal margin and above the inferior gluteal folds. So in English, what that means is right above your buttocks, and if you follow your spine down to right above your buttocks to the left or right, that's where you're going to probably experience some low back pain, discomfort, and even maybe accompanied by sharp pain or some kind of pain in the legs, because they go hand in hand with those ones. And this type of pain can be sudden from an accident, from jerky motions, lifting, or it could be long-term overuse or a degeneration that comes along with age. Um, and the pain may stem from several variety of spinal structures, which include muscles, joints, discs. Um, Poor flexibility can even contribute to that. And whether this pain is acute or chronic, the consequences of the pain are important for the individual because most people with this pain, it can be very debilitating. It could even cause them loss of work, increased use of healthcare services, um, and other things like that. They can really put you at a disadvantage, and it can be quite annoying, to be honest. But evidence-based guidelines for lower back problems suggest that individuals suffering from lower back pain should be educated and given information about how this is not only safe to remain active, but and to continue to work, but it's appropriate for the modifications and things like that. So, that being said, chronic back pain is defined as having back pain for longer that persists, 12 weeks. Um, and things that can cause lower back pain, like I said, are sprains and strains, disc degeneration, herniated discs, sciatica, traumatic injury, playing sports, a car accident, things like that. Spinal stenosis, which is the narrowing of the spinal column, and it puts pressure on the spinal cord, and that comes along with age or skeletal irregularities, such as scoliosis or lordosis or kyphosis. Let me go back and explain that lower back pain can be found through the lumbar region of the back. The L1 through L5 is the lumbar region where most of the back pain occurs. A quick anatomical breakdown of that will be in the spine you have vertebrae, and the vertebrae are protected by intervertebral discs that absorb shock. There's also ligaments that hold the vertebrae in place, and there's tendons that attach the muscle to the spinal column. Also, there's 31 pairs of nerves rooted into the spinal cord that control body movements and transmit signals to the brain, and this can affect pain receptors obviously as well. Low back pain can also, but it's very rare, can be related to some underlying conditions such as infections, tumors, or even kidney stones can cause these problems, as long as as well as osteoporosis and fibromyalgia. Some risk factors to developing low back pain, as I said once before, are age. The older you get, the more elastic the more muscle elasticity and tone decrease, and the vertebral discs begin to lose the fluid and flexibility with age. Fitness level, people who aren't very active or fit have a higher chance of experiencing low back pain because they're not as strong or have enough muscle mass. Women who are pregnant, with the added weight from a baby and you yourself, start to have a low doses and can get low back pain from that. Occupational risk hazards, obviously. If you have a job that requires you lift a lot often, well, there's some things there. And for college students, even, and little children, backpack overload. You see them all the time, books overflowing out of their back and things like that. But back pain can be diagnosed by different means. X-rays, CT scans, discographies, MRIs are just a few ways, ultrasound are just a few ways back pain can be diagnosed and found. Back pain can be treated in different manners. If it's not that bad, if it's acute, hot, cold packs, activity, minimal bed rest, strengthening exercises, physical therapy, and some medications ranging from over-the-counter drugs to anti-inflammatory to even drugs used to prevent seizures, antidepressant drugs, and even topical creams can help with that. Also, some other things that can help are chiropractics, traction, acupuncture is even moderately effective for low back pain. And worse comes to worse, you'll have surgery. It can be invasive or minimally invasive. Back pain can be prevented by exercising regularly, stretching, sitting up straight. A lot of people slouch over too much. This will all affect your lower back pain. And having a proper nutrition and diet will also help prevent low back pain because you're getting enough vitamins and nutrients and minerals into your diet. I know I threw a lot at you there, but I hope I gave you a decent overview of lower back pain. More research is being done on a lot of things, and you can find research and information anywhere on the internet that you go. Thank you and have a good day.